Decompression illness, DCI, occurs either because of lung overexpansion injury or bubble formation within blood vessels and tissues secondary to an excess of inert gas absorption. In each case, the end result is both local and systemic inflammation and tissue hypoxia. As DCS and AGE can be difficult to differentiate, it is fortunate that the initial first aid is the same for both conditions. It is for this reason that diving medicine experts refer to these collectively as DCI. Decompression sickness, or the bends, is the result of bubbles that form and grow in the bloodstream or tissues during or after ascent because excess nitrogen or other inert gas is not sufficiently eliminated. Mechanical effects can cause tissue distortion and interruption of blood flow, as well as biochemical effects that activate clotting mechanisms, systemic inflammation, leakage of fluids out of circulatory system, and reactive vasoconstriction. These effects may persist long after bubbles are gone, and they may play a significant role in the duration and severity of clinical signs and symptoms. Arterial gas embolism, or AGE, may occur as a result of lung overexpansion during ascent while breathing compressed air or other gas mixtures like enriched air nitrox. Typically, this occurs as a result of the diver holding his breath during ascent. The gas is then introduced into the arterial system following lung tissue rupture in the form of bubbles. As the arteries get smaller, eventually the gas bubble forms an obstruction. If the bubble passes directly to the brain, it can cause rapid and dramatic symptoms.
Thanks for coming out with us today.
Thank you very much. Appreciate that.
DCI has a broad range of presentations, many of which are similar to other illnesses and injuries like muscle or joint pain from a sports-related injury or chest pain and difficulty breathing from a heart attack. Decompression illness has no definitive presentation or laboratory test to confirm its presence, and it may involve any area of the body.
Hey, are you sure you're okay?
No, yeah, I'm fine. Just wait.
Signs and symptoms are often vague and can go unrecognized by the diver, causing them to be dismissed as insignificant or not dive-related. Whenever you have a recent history of diving and one or more of these symptoms, you should seek medical attention. Pain is commonly associated with neurological symptoms. It has been characterized as a dull, boring, or aching sensation in or around joint or muscle. It may begin gradually and build in intensity, or be so mild that it is disregarded.
I guess right after this last dive.
Numbness and paresthesia are commonly characterized as pins and needles sensation. These symptoms may also present as abnormal feelings, decreased or lost sensation, or hypersensitivity. Constitutional symptoms are generalized symptoms that do not impact a particular part of the body, but include extreme fatigue, general malaise, and nausea. Other signs and symptoms of DCI: difficulty with balance and equilibrium, muscular weakness, skin rash or localized swelling, altered mental status or confusion, difficulty urinating, blurred vision, difficulty breathing. Symptoms may not appear all at once, but rather may appear at various times following a dive and may range from just after a dive to as much as 24 hours later. Most symptoms will occur in the first 2 hours following a dive, and the more serious symptoms, the quicker the onset. An ascent to altitude, as when flying in an aircraft or driving through mountains, may also precipitate symptom onset. Once a diver is injured, it's important to call for assistance. Call Dan if you're not sure what to do. If you suspect you or your buddy are injured, Dan can assist you in locating a healthcare provider at the nearest available medical facility for evaluation. If necessary, you may receive a referral to a hyperbaric or recompression chamber for definitive treatment. Many injured divers delay seeking medical attention and assistance because warning signs of DCI can be subtle and go unnoticed. Some divers don't seek help because they're in remote locations, feel their symptoms aren't serious enough, or are concerned about the expense of evacuation and treatment. The longer evaluation and treatment are delayed for a diving injury, the lower the chances are of effective treatment and complete symptom resolution. Even after all symptoms have cleared, medical clearance should be sought before returning to diving activity. The benefits of providing oxygen to an injured diver are substantial. Anytime you suspect a dive-related injury, provide the injured diver with oxygen. Prolonged treatment delays, usually measured in days, may reduce the effectiveness of treatment and may extend the time needed to achieve optimal symptom resolution. It should be understood, however, that in a majority of less severe cases, minor delays of a few hours rarely impact the final treatment outcome. Residual symptoms following hyperbaric oxygen treatment are not uncommon, especially in severe cases or when considerable delays in treatment initiation have occurred. Divers who experience persistent symptoms following hyperbaric oxygen therapy should remain under the care of a hyperbaric physician until symptoms have resolved or further therapy is deemed either unnecessary or unlikely to provide further benefit. A decision to return to diving should be made in consultation with a physician knowledgeable in dive medicine.